if it worked somewhere in the NHS, if it produced better results, then it should be something that I own. It was produced by my team. I trust it. The presumption should be it works, it's better. Let's get on and do it. And that includes how we treat our people. We said in the 5-year forward view, we can design innovative new care models, but they simply won't become a reality unless we have a workforce with the right numbers, skills, values, and behaviours to deliver it. My organisation has a statutory responsibility to ensure sufficient supply of qualified staff to the NHS in England. As I've already said, the NHS spends over 60% of its budget on staff, which makes our people by far the most important and expensive part of the NHS, a resource to be treasured. Let me use nurses as an example. Nurses are, and have been since the Crimean War, the lifeblood, the apt for this venue, sinew and muscle that hold the body NHS together. And you can't help but have noticed recent media coverage about nurse staffing levels. The NHS and its patients will always benefit from more nurses, but we must be careful not to make the case in a way that alarms patients and their families when things are improving. Between 2013-14 and 2015-16, the NHS created 26,000 new nursing posts. In other words, the number of nursing posts, not people in them, the number of actual posts went up by 26,000. This was in response to the tragedy of mid-staffs and subsequent reports and action, as well as demand and increasing pressure on our NHS. By the end of 2016, about half of those 26,000 extra posts had been filled. If you want me to be specific, in April 2013, the NHS had 306,181 full-time equivalent nurses in post. In April 2016, we had 319,367 nurses in post measured as full-time equivalents. We're going in the right direction. We didn't manage to